Welcome to our comprehensive review of complications associated with dental local anesthesia. In dental practice, local anesthetics are essential for pain control, but they can sometimes lead to unexpected complications. These complications are generally classified into two main groups: those arising from the drugs or chemicals used, and those resulting from the injection techniques themselves. Understanding the causes, prevention, and management of these complications is crucial for safe and effective dental care. In this video, we'll break down each complication, discuss real-world scenarios, and provide practical tips for clinicians and students alike. Dental local anesthesia complications are broadly divided into two categories. The first group includes complications arising from the drugs or chemicals used, such as adverse reactions to anesthetic agents. The second group involves complications related to the injection technique, including mechanical injuries or procedural errors. Recognizing which category a complication falls into is the first step in determining the appropriate preventive measures and management strategies. This classification helps clinicians quickly identify the root cause and respond effectively, ensuring patient safety and comfort throughout the dental procedure. One of the most common complications, especially in children and mentally or physically challenged adults, is soft tissue injury. This usually results from accidental biting or chewing of numb lips, tongue, or cheeks after local anesthesia. The loss of sensation makes patients unaware of trauma, leading to self-inflicted injuries. Understanding this risk is vital for clinicians, as it often goes unnoticed until after the appointment. By identifying patients at higher risk, dental professionals can take proactive steps to minimize the likelihood of soft tissue injuries. Prevention of soft tissue injury starts with patient and caregiver education. Clinicians should warn parents or guardians about the risks of biting or chewing numb areas. Using local anesthetic agents with a shorter duration of action, when appropriate, can reduce the window of vulnerability. Additionally, always use the minimal effective dose to achieve anesthesia. Advising patients to avoid hot foods or drinks until sensation returns is another key preventive measure. These steps collectively help reduce the incidence of soft tissue injuries in dental practice. If a soft tissue injury does occur, management is typically symptomatic. Analgesics can be prescribed for pain relief, and topical anesthetic gels may provide additional comfort. If a secondary infection develops, antibiotics may be necessary. Most soft tissue injuries heal without complications, but it's important to monitor the patient and provide clear instructions for home care. Prompt intervention and reassurance can help prevent further trauma and ensure a smooth recovery. Sloughing of oral tissues, including epithelial desquamation and tissue necrosis, can occur after local anesthesia. This complication is often related to excessive volume or prolonged application of topical anesthetic agents, especially on palatal tissues. The use of vasoconstrictors, such as epinephrine, can also contribute by causing severe tissue ischemia and necrosis. These effects are most commonly seen in areas where the mucoperiosteum is tightly bound to bone, such as the hard palate. To prevent sloughing of tissues, it's essential to use topical anesthetics for only the recommended duration and avoid excessive volumes, particularly on palatal tissues. Exercise caution when using high concentrations of vasoconstrictors, as these can increase the risk of tissue ischemia and necrosis. Selecting the appropriate anesthetic agent and technique for each patient's needs is key to minimizing this complication. Proper technique and vigilance during administration can greatly reduce the risk. Management of tissue sloughing is generally supportive. Most cases resolve spontaneously within 1 to 2 weeks. Symptomatic care includes analgesics for pain, topical anesthetics for comfort, and a bland diet to avoid further irritation. If a sterile abscess forms, it may require incision and drainage. For immunocompromised patients or those with HIV, AIDS, inform the appropriate authorities and consider post-exposure prophylaxis. Close follow-up ensures proper healing and addresses any complications promptly. Needle stick injuries are a significant occupational hazard in dentistry. These injuries typically occur due to careless handling of sharp instruments during or after injection. Such incidents not only pose a risk to the clinician, but also to the patient, especially if there is potential exposure to blood-borne pathogens. Awareness and adherence to safety protocols are essential to minimize the risk of needle stick injuries in the dental setting. Prevention of needle stick injuries involves exercising extreme care with sharp instruments at all times. Clinicians should follow strict protocols for handling and disposing of needles. Prophylactic vaccination against hepatitis B virus, HBV, is recommended for all dental professionals. By maintaining a high standard of safety and awareness, the risk of needle stick injuries can be significantly reduced, protecting both staff and patients. If a needle stick injury occurs, management depends on the nature of the injury and the infection status of the patient. Immediate steps include following institutional post-exposure prophylaxis (PEP) guidelines. This may involve wound cleaning, baseline blood tests, and possible administration of prophylactic medications. Prompt reporting and documentation are essential. Early intervention can prevent serious consequences and ensure the safety of the dental team. Needle breakage during dental injections is rare, but can be alarming. It often results from sudden, unexpected patient movement or the use of thin, high-gauge needles. Other contributing factors include previously bent needles, redirecting needles within tissue, or manufacturing defects. Proper technique and equipment selection are crucial to prevent this complication. To prevent needle breakage, inform patients about the procedure to minimize sudden movements. Use appropriate gauge needles, such as 25 gauge for deep nerve blocks, and never insert the needle completely to the hub. Avoid redirecting needles once embedded in tissue, and always use high-quality needles. These precautions help ensure safe and effective anesthesia administration. If a needle breaks and the fragment is visible and protruding from the soft tissue, gently grasp it with a hemostat and remove it. If the fragment is not visible, do not probe blindly. Instead, refer the patient immediately to an oral and maxillofacial surgeon for further management. Staying calm and following protocol ensures the best outcome for the patient. Hematoma formation is another possible complication, usually resulting from nicking blood vessels during injection, especially in posterior superior alveolar or inferior alveolar nerve blocks. Prevention relies on a good knowledge of regional vascular anatomy, using short needles for PSA blocks when appropriate, and minimizing the number of needle penetrations. Careful technique is the best defense against hematoma formation. Immediate management of a hematoma involves applying direct pressure to the area for 2 to 3 minutes if accessible. The patient should be observed for at least 12 hours. For delayed management, reassure the patient. Apply external ice packs initially, followed by warm packs later. Analgesics and muscle relaxants may be prescribed if trismus develops. Most hematomas resolve without further intervention, but careful monitoring is essential. In summary, complications from dental local anesthesia can be minimized with proper knowledge, technique, and patient communication. Always assess patient risk factors. Use the correct anesthetic agents and techniques, and be prepared to manage complications promptly. Educating patients and caregivers, following safety protocols, and maintaining vigilance during procedures are the keys to safe dental anesthesia practice. With these strategies, clinicians can provide effective pain control while minimizing risks.